I think it is not wrong when it is said that movement is medicine. And if movement is the medicine, then physiotherapy is that prescription for a healthier and a happier life. If you also abide by the same and if you follow the same principle, then you have come to the right place. So, hello and welcome. This is your host, Himanshi Kaushik, and I heartily and sincerely welcome everyone here in this session today. And I hope that you are as intrigued as I am to attend this session. So, today we actually will be learning about physiotherapy and how we can use this science in the critical times, in the critical care when it is needed. And for this, we have our expert here. And before I introduce you to our expert, I hope that you all are doing good, happy, sound, and healthy at wherever you're taking this session from. So we have Dr. Thiagarajan Subramanian. He is a faculty, a professor in cardiopulmonary physiotherapy in School of Physiotherapy and Medical Sciences in lovely professional university here with us. He's a magnetic personality with over 20 years of experience in physiotherapy profession. He has published over 15 research publications in reputed journals by now, and he has been a part of various research projects in various capacities. And now we are all obliged, so that he has joined us and he will be sharing his experience, his knowledge. So, sir, we are very much happy to be here, and it is our pleasure to be able to listen in the webinar and to learn this science for our own good use. And with this, sir, I welcome you in the webinar. And before I request you to carry on the session, I just want all the participants to know that now you can post in your queries, your questions, your thoughts in the chat box, in the Q&A box, or you can just raise your hand at the end of the session so that we can allow you to talk, to have a chat session with our expert directly. So with this, sir, I request you to please take over the screen, and looking forward for an amazing session.
Thank you, Ms. Manshi. Good morning, everyone. Myself, as I introduced, I'm a professor in cardiorespiratory physiotherapy, and one of the key branch in physiotherapy domain, one of the allied healthcare profession, pandemic or indirect globe. During the pandemic, so we faced a lot of issues, and major issue we faced is respiratory care and respiratory issues. And specifically, we work on the area where we can prevent some complications followed by the respiratory problems, and especially in the ICU. Okay, so before starting, I just want to ask you all, so how many of you from the medical background, or you are going to aspire for the any? Yeah. Okay, can you please just mention your qualification, PPT or MPT or basic okay. BPT, yeah, few people is going to opt for BPT. Yeah, no problem, Sarang. I'm going to talk about very basic about the critical care. So, and if the student who is going to join BPT, so they will also come to know what are the branches in the BPT. Yeah, students already passed out BPT. They can choose which specialty and what are the opportunities, what are the specialties, or what are the expertise areas which we can work after MPPT also. So these things will be covered in this session. And of course, I'm going to give you some few idea so how we can work in this critical care so that we can do many research and projects. So that is another aim to those who completed master's program in any discipline. Okay, whether it is a MPT neuro, ortho, cardio, pediatrics. So how to fit into that, the critical care in their particular domain. So these are all the few ideas which I'm going to share today. Okay, of course, many people think Siddesh taken MSc CDPR. Good, very good. And thank you. I think a lot of queries so far. Right? Okay, fine. So a majority of the students are from the BPT passed out students. So we'll go as per their requirement. Okay. Okay. So I hope everyone is able to see the screen. As you know that critical care. So what are the images which we can able to see in the screen, the first screen? When you find a person is critical, when will you find a person is critical? By seeing this, the first slide of the presentation, can you able to pick up any idea? There are few equipments are there. Can you guess what equipments are there in the screen? Few instruments for helping to assess, or helping to find out. Yeah, so we have different types of the tools which can be used in our critical care. So when you are on the road, if someone is critical, exactly, Sarang, yeah, sphygmomanometer is here, okay, and stethoscope is here. Okay, when you are walking in a road, if you find someone is fell down and unconscious, completely blank, so what will you do? Okay, so you require some tools, okay, some tools to assess. Okay, so basically what we do is we use the palpation skills. Okay, so though we have some equipments or not, so we can try to identify if the person is critical or not. Even some students from the freshers joining for the degree program also in this team. So for them, I'm telling you. So anybody can able to check a person is normal or conscious or unconscious. Okay. So how do you, if a student who passed out from the BPT, any one of you, how do you categorize the consciousness? How do you categorize the consciousness? How do you categorize consciousness? In which scale you use? I think some neurology students also here. MPT neuro. Those who are flying, yeah, exactly. We use the TCS scale, Glasgow Coma scale, right? Very good. Yeah. So here, so if you want to identify whether the person is conscious or unconscious, okay, so we need to analyze few particular part of the body, and especially one of the key part, check our respiration. So externally, how do you check your respiration? So by seeing the movement of the chest, the person is alive or not. But also we can easily, simply a person, common person, lay person, how they analyze, just simply they can identify the person's chest movements, right? By knowing about the movements, and then only if a person who knows better skill, yes, of course, a nursing student is here, they can able to palpate. Okay, here there is a one important vessel, carotid artery, okay, which can be a basic foundation skill. Okay, so if you become a physiotherapist, if you become a nursing, if you become a emergency care technician, okay, so these particular skill will be developed. Okay, as a student of the beginners of the degree program, so you can just plus two students are here, so you can easily able to identify. Not only here, we have advanced techniques to assess the lung functions, and of course, what will happen in the critical care unit in ICU. Okay, these role are important when you study for the Bachelor of Physiotherapy program. In BPT, we study all these almost equally. We study the entire human anatomy, human physiology, and exclusively I am talking about with the respiratory system physiology, right? So now you can see here one ground. Can you tell what is the ground? What's the name of this ground? Yeah, very good. Sarang and Siddesh. It's a tennis ground. Okay. Can you relate this tennis ground and the lungs? Can you relate the tennis ground with your lungs? And anyone can relate it? Exactly, Siddesh, you are right. It is when you just remove your entire part of the lungs. That means if you remove the each and every part of the functional unit of the lung. So the functional unit of the lung, which we studied from our school time itself, it is the alveoli. Okay, alveoli where the oxygenation takes part. Right? When the alveoli, if you separate it, make it in a single layer, so approximately the entire the tennis ground, the size of the tennis ground is equal to the surface area of the tissue, alveolar tissue, when it is get flattened. If it is removed and it's in a all in a sac, but if you remove it, if it is in a flat surface, so it covers the entire tennis ground. Okay, and of course, all the alveoli which is connected with the vessels. Okay, the alveoli which connected with the vessels with the names of from the bronchi, bronchioles, primary bronchi, secondary and tertiary, and bronchioles and alveolar duct. So all these tubular structure where the gas is passed inside the lungs, if you connect all together, can you guess how long will it be? Will it be? Can you guess how long will it be? The clue is in your screen itself. When you just extend all the tubes of the alveoli, so the length of the complete alveoli, can you guess? Anyone? Nearly, it is, yeah, not, it is 1500 miles. It is not only 15 kilometer, 1500 miles. So just imagine when I talk, I expel the air out. When I breathe, I took the air inside. Do you think we all transport the air throughout the entire 1500 miles? It is not. It is not because of our lifestyle, our body type, and environmental factors. So we are not doing the deeper inhalations. So even if a normal person, we are not completely utilizing the entire pathway of the 1500 miles. Just imagine a person who is critically ill, he could not be able to achieve the normal tidal volume. The normal tidal volume means the amount of air inspiring and expiring. Okay, so that for every breath. So approximately, anyone remember normal tidal volume? How much volume? Anyone guess? Yes, exactly, Siddesh. It is 500 ml. So how we are going to use it? So when the person is in critical situation, either in the roadside or in the critical setup, so we are going to improve the ventilation and thus improve the oxygenation. These 2 points are a key role for the critical care physiotherapist. So here, everybody, of course, nurses are also there. I'm taking the credit of nurses also. We parallelly nurses and physiotherapists, so we work together, okay, and helping to improve the ventilation and as well as the oxygenation. Okay, so through that, we can achieve the oxygenation and as well as the ventilation of the optimal level to maintain the saturation above 95%. Okay. The person is going to be critical. Sorry, I got disconnected. Just sorry for the inconvenience. Yeah, I'm just sharing it again.
Yeah, just a minute. Okay. I'm very sorry, participants. I think there was some network lag that we both got disconnected. So we'll be sharing the screen just in a minute now.
I hope it's visible.
Yes, it is visible. We good to go, sir?
Yes, I'm just transiting the slide. So when you connect together these two dots, oxygenation, ventilation, so we people work on either the orthopedic physiotherapist or neurophysiotherapist or the cardiophysiotherapist, whomsoever it may be, who visit to the ICU. Do you think which is the optimal first technique to improve the ventilation? Can anyone guess? Question is for the master students. Master students, anybody? What if when you enter into the either you are a neurophysiotherapist treating the spinal cord injury patient or head injury patient or stroke patients? Exactly, Sampriti. So you are going to position, changing the position, it's a key part of it. So rather than doing any other miracles, so simply you do positioning and changing the positioning. And the importance of positioning, I know everyone is know one word, two words. During the COVID time, everybody says the two words related to the positioning. Related to the positioning, even cardiologists who are the intensivists, who are the anesthetists, you believe it or not, that time only every physios, they proudly raise their collar, what we did. Now, of course, nursing also, nurses also, they used to do this positioning. But in COVID time, everybody forced to focus on this positioning to save many lives and to save the lung capacity of many of the COVID victims. Can you tell that two words? Anyone remember that two words? Everywhere in the news magazine, papers, everywhere, two words are used. Yes, exactly. Dr. Samriti, you are right. It is prone ventilation. Just make the person to ulta, right? Just make the person instead of straight lying. So they are making the person to prone ventilation. That means a prone ventilation. Person can breathe in a better way, or they expand the lungs where there is a larger part of the lung surfaces or the back of the body. Okay, in our trunk, the back or the posterior part of the body. So most of the lung surfaces are covered compared to the anterior surface. As you know that the anterior surface, we have the lungs up to the sixth rib, and whereas in the posterior or back of the lung or back on the back side, so the lungs are expanded or extended till the 10th rib. Okay, this is the different, almost 4 ribs level, it has been expanded. And of course, the anteroposterior diameter also compared to anterior to midline, axillary line, the posterior part will be more larger. When the midline to or axillary line to posterior border of the lungs having the larger surface. So that when we keep the position in a prone position, so the most of the lungs are preserved by your normal breath. Of course, what I have told, 1500 miles, the transfer traveling of the air, it is quite difficult for a normal person itself. Okay, but at least we try to reach as maximum as possible areas to be filled with the air. Such a simple way, we saved many lives. Okay, we never use different techniques, we never use different adjuncts, we never use different technologies. Okay, simply they saved their life. So when we studied in the first part of the PT cardio, the first topic is body positioning for the critical ventilation and as well as the oxygenation. Okay, so of course this can preserve only when the person is having a GCS. Can you guess GCS how this ventilation can be prone ventilation can be used mostly when a person is having a GCS above 12. Okay, if the person is unconscious, so we turn the position periodically. Okay, of course, it will be helpful in case of the any respiratory compromise. Then only we are using, not in all the situation, right? And of course, another some basic point I just want to connect it, and then we'll go to the advanced critical care management. And what are the key points which we are going to analyze from this session? And I just want to remind you all. So try to identify the problem first, and then we will work on it. Okay. And furthermore, we have the more sessions to plan. So of course, in this we are trying to solve many problems and identification, and how we are going to work on the PT management in critical care. Okay, so today I'm just going to give the just a bird's view. I'm giving you the some ideas to use in the critical care. So though we are having the entire air entry of the ventilated part, but not all the air take part in the oxygenation. So as you know that some portion where there will be a air entry will be there to expand the airway, to expand the lungs, but yes, Sarang, yes. Of course, I'm there. Yeah. So here we are using some particular portion of the airway. So in the lungs, we have the different airway. Of course, yes. Okay, I agree with you. So there are another important point. Yes, of course, this particular, I just want to tell you a few points that what you are going to study after PPT and after during the PPT both. Okay, so that it will be you will get an idea. Just imagine if a person who have passed out from the +2, if you join for any other medical program, okay, people many times they prefer to go for the becoming a doctor, cardiologist, neurologist, orthopedician. So like that, they have some dream. Okay, so in this particular area, even for the respiratory area, so or in the cardiac area, we can work with the physiotherapy. That is the main point which I am going to focus, right? Okay, so of course, yes, you keep in touch with us, Sarang. So we will definitely give you some more information. Since this platform is having with the multiple, okay, I will try to help you in this. Okay, fine. So here the lungs have the a specific part of the body which receives the ventilation in multiple ways. Okay, that's why one is the conductive portion, another one is the respiratory portion. So conductive portion where the particular part of the bronchi, primary and secondary tertiary bronchi, and the bronchioles, and above till the extent of the respiratory bronchioles, the air entry will take part to expand physically. Okay, but the residual part, remaining part, alveolar duct, alveolar sac, alveoli, so there only the ventilated oxygenation will be take place, because there only it has to utilize the oxygen. Okay, whatever you are inhaling, okay, when it is reaches to the entire part of the alveoli, then only it start using the exchange of the off. Okay, so what you studied from the school time, so oxygen and the CO2 exchange happens in the lungs. Okay, so that is the point where we are going to work on. So when you in a critical situation, so the patients will be struggled with the oxygenation issues. Okay, that we are going to see in a different methods of the. This is actually a conducting portion. Okay, as a lung is started with the air from the air entry, the nasal cavity, nasopharynx, oropharynx, larynx, trachea, and bronchi, bronchioles. So all together, which allow the air to entry. Okay, allow to enter the entire part of the lungs, but it does not take part in any exchange of the lung. Only the respiratory portion where the respiratory bronchioles and the alveolar duct, so which can only helps to transport the oxygen from the air. Of course, we got a 21% of the oxygen, so utilized, that will be transported through the bloodstream. Okay, that with the so this any other issues in this particular transport only when the person get critical. Okay. So when we are changing the position front and back and side, so this will alter the increasing in the oxygenation so that the person will become better than the previous worsening stage, right? And another important thing, we are, as uh, Himanshi ma'am told, the science of movement. Physios, we work on the science of movement, either mostly the orthopedic or the neurologist or cardiorespiratory. Here, the important movement is there is a movement of inspiration. The movement because of the diaphragm, which is pulling down. The more the diaphragm pulls down, so more the air is entered. Okay, diaphragm. And another thing is the expiration that we call it inspiration. And after that, the elastic recoiling property, so which can, which can also rises fine. Okay. Yes, please. Can you please give the name of the muscle for the respiration? Names of the muscles of respiration? Any one muscles? Of course, in school time you might studied diaphragm. Very good, Arghya. But we work on some more muscles. Exactly. Ashwini has given excellent intercostal muscles. Always remember EI. Yeah. EI. Always I use the word E and I. Okay. Whenever expression, E for expression, the I is internal intercostal muscle. Okay. Similarly, if you take IE, whenever there is inspiration, there is external intercostal muscle for the inspiration. Okay. EI and IE. Yes. Of course, apart from that, pectoralis major and upper trapezius. These are all the accessory muscles. Okay. So which can helps to increase the ventilation easily when there is a critical situation, right? Okay. So here what we are going to analyze some of the technique to facilitate techniques to facilitate the respiration. So we used to apply some technique to increase the ventilation when a person is in a critical care. So we used to just want to give the name only. Later we will discuss in the further more classes. There is a neurophysiological facilitation technique. Okay, through for when the person is unconscious, when the person is critical, so we can train the person by using the manual techniques. We'll discuss detail in the later. Just to skip to main part of the critical care management, which I just want to focus. Of course, you can work in ICU if you study this particular course. You can work in ICU. You can practice or visiting consultant physiotherapist in a hospital, and also, of course, you will be in a part of the team where you can work on work as a teacher after passing your master's program. Okay, so and many of the courses, postgraduate diploma courses also available in the critical care techniques. So basically, already we understood about the functions of the body related to the respiratory system, and another important thing is the lung volumes and capacities, basic point of it, and the main purpose of knowing about the ventilations and ventilators. The two things are there. One is with the lung compliance, and another one is the resistance in the airway. These two are the two important points. So how we are going to choose the right support system during the critical situation. So using the physiotherapy intervention. This is the one part which we just need to focus over here. As you know that I told 21% of the oxygen from the atmospheric air. So do you know which gas is the maximum? Which gas is the maximum in the entire atmosphere? Is it oxygen? We are living in the earth. So we live because of oxygen. No, it is not because of oxygen. And it's not maximum of oxygen, it is maximum of nitrogen. Exactly. Okay, nitrogen is so just imagine we use consumes 21% oxygen. So we try to conserve the oxygen because we in the entire atmosphere we have only 21% of the oxygen. Okay, entire 760 millimeters of mercury pressure, atmospheric pressure, we have 21%. Okay, for that exactly what we need, how much we require, approximately for the normal oxygen saturated oxygen pressure, partial pressure of the oxygen, nearly 80 to 100 is required. Okay, so approximately, and in the in terms of percentage, 95 and above will be the saturation SpO2 level. Normally, what we do with the pulse oximeter, I'll show that later. And how these are all the few points which we need to focus when we are. Screen is visible.
Yes, sir, it is
Okay,
visible.
yeah. Just can you give me 1 second, 1 minute break? Just connecting the.
Yeah, no issues, sir, no issues. So I would want to request everyone, if you have any other query, as in not other, as in if you have not posted the queries, your thoughts, your questions, you can post in the Q&A box so that sir will answer all of them and you can get the resolution of them. So any thought regarding the topic, regarding the discussion that we've had today, and the question that you might have, you can just post in the Q&A box.
Yeah, as actually ma'am asked, so I just need a, segment-wise questions from the students from the school level. What do you want to ask? So that remaining half an hour will be, I can give the more it's the interactive rather than single. I can show with explanation wherever according to the doubt, I can show the pictures and images from my presentation, so it will be easier. You don't require the need, Sarang. You don't require the need for this particular program. You can directly write the LPU Nest exams. So which you can just contact our. They will be contacting you if you need any other more information. So you can directly apply that test, and they will guide you about the further proceedings. Okay, we conduct the Nest, not the NEET. One E is missing. I hope you understood. LPU Nest, the name of the entrance is, I think, is it required, ma'am? Still, LPU Nest is almost over, I guess.
No, sir. Actually, I think
Some,
they will be knowing this on the website itself. Like it depends
okay,
subject to subject and post to
it
post.
differs.
It differs, right?
Okay, okay. Yeah, I should not give the false information. That's why I
Yeah,
just want to
exactly.
confirm with you.
No issue, sir. At the end of the session, I'm gonna tell them like where they can find all these details and how they can contact us. Or I will be telling them.
Yeah, any bachelor students, any queries from the BPT or some allied medical people also here? You can put your query here. Any BPT students? Okay, okay. I think Shahid, yeah. So let's, yeah, job opportunities. That's why, because we have the bachelor program, okay, with the BPT for 4.5 years. So after completing this 4.5 years program, that means 4 years only you will be in the university. And after the 4th year, so you will be starting your clinical training, internship training. That means you will be posted in the hospital, and the hospital training only for 6 months. Then after that, completing that, you will be given the degree. Okay, so with after the PPT, you can do two things. Either you can do job, or you can run a clinic. You can work in fitness centers and sports complexes. So everywhere there will be opportunities are there. And of course, after BPT, the master's program, when you want to specialize, okay, neuro, ortho, cardio, and sports are the major discipline. Of course, pediatrics are there, but now currently we are running with these 4 programs: neuro, ortho, cardio, and sports. And especially in the cardio, which I am working on as a professor, and another associate professor, Dr. Priyanka Rishi, and one more assistant professor, Dr. Aditi. 3 people are working with completely with the cardio setup, and we have the setup with the both IPD setups and the OPD setups for the cardiorespiratory rehabilitation. Okay, let's push to the next segment of this. Okay, thank you. Yeah, so I just want to go little detail for another 10 minutes only. So then we will be winding up this session. So that's so many programs are on the row. So I just thanks for the team again. So this is the basic point. When you see in a normal respiration, the lung volumes, you know very well, the students who study bachelor's, they might know already the lung volumes and capacities. So based on the variations, how we are going to analyze when a person in a critical care. So for that, we have the different graphical analysis. We can call it as a ventilator graphics. Anyone know what is ventilator graphics? PPT student. Ventilator graphics. Anyone know ventilator graphics? Anybody? Anybody heard about this? I'm just typing it so that you can. Everyone knows about the graphics. Very thoroughly, and this is actually same what you see in the graphical representation. What are graphical representations in this screen of the lung volume and capacities, which you studied in the physiology. Remember the first year. Okay, so similar pattern of the graphics which you can see in the ICU, and that I can show it right now. You can see the graphical representation which is explaining the flow, the first graph, and the second one there is a pressure variations, and third one the volume variations. This is a graphical representation. Yes, exactly. It's a visual representation. When a patient is unconscious, patient does not explain anything, unpleasant sensation. Okay, this is the device where the ventilator screen, the monitor, which gives us the information very quickly, so that the physios, nurses, which can who can work in this area, so you can identify the problems quickly, and we can restore the functions faster. Okay, especially the two both things are ventilation and oxygenation, so will be improvised with the various techniques. Okay, so the ultimate aim of critical care physiotherapy, everybody knows about PPT. After PPT in cardio segment means they know they want to give breathing exercises if the person is conscious, and if the person is conscious, we can use the airway clearance techniques, coughing and huffing technique to remove the secretions. Everyone knows that. But when the person is in ventilator, what should we do? That is our upcoming workshops which we are planning in the continuously. a kind of a series of the workshop and webinars. Okay, so which we work on the analysis, how to analyze the ventilator graphics. So, what are the benefits when you work as a team in this part? So, this session I'm just giving you the outline for the both the already becoming physiotherapist or going to be a physiotherapist. Okay, so this will be the eye-opening session. That's why I just want to give this as a main core point of the critical care physiotherapy. Of course, how we are using. So, many of the people we treat the patients, okay, without evidences. So, please try to understand the evidence-based approach. So, the next segment we are working on the evidence-based approach and how to use the suitable techniques, okay, for clear the secretions so that in the ventilator patients so will be recovered as quick as possible. So you know the very well the intubation. So when it crosses beyond a week or the 2 weeks, the chances of the criticality will be more. So as early as possible, if you recover. Okay, so apart out of the major part of nursing and physiotherapist, so we should work together and we do a lot of wonders in quickly recovering the patient from the critical situation. Right. So that is one of the important key point. Of course, another important area which we work on the ventilator, we should be aware of the one more point also. I just want to go back. As a physiotherapist, when a person is, yeah, I hope you've seen this device somewhere. Can anyone guess what is the name of the device? Yeah, I just want to tell the student of beginners of the graduates. Yeah, we work in different techniques. We work in different areas when device handling the devices. Okay, so you will get a very good learning experiences when you join this university. Of course, when you join with the cardiorespiratory domain, so you will be learning a lot of things. Yes, of course, Sidesh, you are right. It's a breath assist, but exact name, anyone can technical name, especially MPTs and BPTs can tell BPT final years or passed out students. Exactly, Dr. Samriti, you are right. So this is a CPAP. So many people nowadays, in old age people, they die of sudden death when they sleep. People got the many informations and they say it is a cardiac arrest, sudden cardiac death. Okay, it's nothing but it is a sleep death. The condition name, which is called as there is a blockage of the airway or a blockage of the air to the brain, a sudden collapse which can causes the sleep death, which is known as a sleep apnea. Apnea means there is a stop of breath. So when they sleep position, so the people used to die as quickly as possible. Okay, so that's why they uses the device which is called a breath assist. Of course, CPAP, continuous positive airway pressure. That means the air will continuously intubated or inhaled forcibly by the sealed mask. You can see here there is a sealed mask is here. Okay, this is the sealed mask which you have seen here on the left side of the nasal mask. Okay, in this picture, what you are seeing. Okay, and of course, why I'm telling this as alert, so many conditions are there, people who are obese. So we work on the two things. A person who can reduce the obesity, you can prevent the sleep death. Extreme obesity, short neck people, you can identify and we can do a lot of wonders over there to save the life of an individual. Okay, so many articles are supporting for exercises in sleep apnea. Still, there are a lot of areas to work, okay, to control the obesity. Then only the benefit of CPAP will be 100% utilized by the individual. So this is another one interesting area to work when you become a physiotherapist, when you become a cardiorespiratory physiotherapist. So this is the sleep support. Okay, sleep area, we can work on that. Of course, this will be used as a ventilator support during the entire COVID time. We are not using all time intubatory method. This is non-intubatory method. That is, when you do intubation, we have to insert the tube, insert the artificial trachea. Okay. Anyone know what is the artificial trachea name? What is the name for artificial trachea? How do you name it in the? You're just inserting artificial trachea. What is that name? Anyone? It can be, yes, Durga, you are right. It is a tracheostomy. Another one tube can be inserted through oral. Tracheostomy through cut. Exactly, Arya. It is ET tube, endotracheal tube. Okay, these tubes are supporting. Of course, you can see here. This is the endotracheal tube. This is one of the ventilation. Other ventilation is by tracheostomy method and as well as with the orotracheal tube or endotracheal tube. Through the mouth, we insert the tube, artificial trachea. You can just imagine when a person is having the control with the only, I mean, having lost that control using with this ventilation, so which requires some additional support by the physiotherapist. So we need to work on some manual hyperinflation techniques. Is the most recent evident technique than just giving a typical or conventional chest PT, and we are not working on the internal pressure variations in the lungs. Okay, then only we can improve the oxygenations and of course the maintain the ventilation as well. Okay, so these two are the two important points. And of course, the another important point which I have mentioned already, the ventilator graphics. So these are all the important topics which we are covering in the next segment. So wait for the July 17th. The next more segment is there. So when we are working on mostly on the in details of the analysis of these patterns. Okay. So yeah, this is actually beginners. Some beginners are also there. Some basic PPT students also there. So I just gave this as a eye-opening session. And in the coming July 17th, we are having more and upcoming webinar series and workshops, hands-on workshops also we are planning on the go for every weekends. Okay, thank you very much. Still more any questions to ask, you can just put your queries here. Still we have a few minutes to go.
Yeah. And so before we go on to the questions, I'd like to thank you, sir, for coming in and for giving in your time. And all the participants are already thanking you. And I have read this student who has thanked you for the guidance. I think you have told about what can be the future prospects of, after PPT. So basically, thank you so much, sir. And thank you so much for sharing your knowledge, your experience to all. And with this, I would want to ask anyone, if you have any query, you can post in the chat box. Okay, you can post in the Q&A box so that we don't miss it and they get segregated here. And meanwhile, sir, they write in their queries, I would want to take your permission. Okay, so we got a question from Dr. Samriti. It says, can you please tell me about the ventilator mode?
Yes, of course, the ventilator modes, why I'm not talking about in detail now. So you can see this particular, when a person is unable to breathe. Okay, so we need to connect with some artificial respirator, that you can say it is a mechanical ventilator. Okay, so when a person is completely unconscious, so we use to continuous mode. There is a mode where the air will give the continuous inspiration and continuous expiration. So you can look at here in the screen. So there will be a tidal volume VT. You can see in the left bottom VT. The tidal volume will be kept in a constant mode. Okay, continuous mode. So it will be normally 500. So we can keep it above 500 to 600 ml. They keep it for the. At the same time, when you keep on pushing the air in the lung, it is very important. So the air should come out. Otherwise, the lung will expand more and it will get a barotrauma. Okay, so that's why we keep the another one important setting is PEEP. So these tidal volume, PEEP, and the mode of the ventilation should be, we have to verify before you are going to learn about you are going to apply some technique. So that's why how to analyze the mode and the waveform will be in detail in the upcoming classes. Okay, definitely we will work on it. Yes, we are adding that recent advances. Of course, we are the manual hyperinflation is the reason the advanced techniques only. Instead of giving only chest PT, Dr. Siddesh. I think Siddesh, you are from Maharashtra, right? Okay, thank you. Yeah, I hope Dr. Samriddhi, you got cleared. So we'll be working on more modes are there. Another important mode is SMB mode. SMB mode, the therapist, we need to be very focused where we are going to use the techniques of manual hyperinflation techniques so that we can facilitate the weaning very faster. Quickly we can wean the patient. So you can get the tremendous responses when you use the proper evidence-based approaches. Thank you.
So this another question came from Arya Chatterjee. So it's like she wants to know, are there any books or articles that you can suggest to her for PT management and ICU?
Yes. Actually, there is ICU textbooks normally available in the online forum. We have a lot of materials also. Of course, we do the another important thing. American Thoracic Society websites are given some. Yeah. This is the basic references. Always you can prefer for ATS references will be always sufficient to use it in the PT management. Evidence-based approaches you can always search in the manual hyperinflation techniques in intensive care management. That is very important rather than chest PT and other techniques. And of course, more of clinical decision making. How to apply the ECG variations and respiratory pattern. So, and also we have to analyze the APG values. These are all the advanced methods to analyze the patients that we are working on the next session. Next session, I'll be taking of the APG analysis and also the pulmonary function testing, and I'm correlating with the ECG. Okay, all together we are working on it. Of course, Buteyko breathing technique. Of course, it's one of the old technique which used in the asthmatic patients widely. So we try to use it only when the person is in the awakening stage. We can use it for the Buteyko breathing technique. Recent trends, that's why we are working on more of two things, neurophysiological facilitation techniques and manual hyperinflation. We are working on the research. We will work on more. If you are interested, we will join more on this area. Dr. Siddesh.
Right. Sir, thank you. And I hope all the queries of our participants are now resolved. And thank you, sir. The way you've explained is really appreciated. And again, all the participants are already thanking you in here. And with this, sir, I would want to take like 2-3 minutes to explain them about the site and where can students actually take admission and what they need to do in order to take admission in here. So can I show them a little about site just in 2 minutes?
Yes, okay, go ahead. 1 second, Dr. Manshi ma'am, just one query.
Yeah, no issues, sir.
Dr. Samriddhi, yes, actually, yes, we are working on exercise ECG. Exercise ECG is one of the very beautiful area where we can you can identify each and every person's cardiac output variations after the doing exercises. Because of course, when instead of critical care ECG variations, of course we work on it, and I am taking the classes of exercise ECG and how we can use the telemetric ECGs in our clinical practice. So that demonstration workshops I will be taking.
Right.
Okay,
so
that in upcoming we'll do it. Thank you.
Correct. And I will be showing you all the participants here where you can find actually the upcoming webinar that sir has already been talking about. Right. So I will be showing site here, and I hope my screen is visible. Yeah. So basically, just to give a brief, as in where you need to find the webinars. Okay, just in a moment. Yeah. So this is the site, that is lpu.in. This will be the site. You put in the site in the browser and this will be the interface that will be coming in front of you. Now you go to simple admissions here. And once you go to the admissions, you will be seeing at this left hand side LPU's Edufair webinars page. So once you click on this page, you will be seeing all the webinars that are enlisted here. You can see consumer protection laws. I mean, there are various webinars that are planned for almost every other day. So you can just simply register from these webinars in whichever you want to and gain as much as knowledge as you want. And now also just want to let you know that this session is already recorded, right, and will be uploaded on YouTube. And how you can find it is you simply go to the past webinars here. You go to this past webinar, right, and see here you can see view YouTube recording. You click on any of the webinars here and your YouTube recording will be started. So here, from here, you can actually find the past and the upcoming webinars. Now moving to the admission process, I will be just giving you a brief. You go to the admissions, you go to, whichever qualification you have. If you are 12th pass out, you go to after 12th. If you have done your graduation, you go to after graduation, that is here. And if you are postgraduate and want to take an admission in doctoral programs, you go to doctoral programs or after post-graduation programs. So I'm just taking an example of a 12th pass out student who wants to take an admission in regular program. So I go to after 12th regular program and I will see the disciplines, lot of disciplines. Choose a discipline that you want to. Since we've been talking about physiotherapy, why not take the example of same? I chose physiotherapy here and I click the program that is offered under that discipline. So once you click on the discipline, all the programs that are offered would be visible. So once I click on this program, these are the highlighted option that would give you everything that you need to know about a particular program. You can see this program details gives you eligibility, whether you are eligible for a particular course or not. So you can check the eligibility here. Moving to the highlight option, that would actually tell you what all research is, what all students are achieving, and what the rankings are of the university in context with the course or the stream that you've chosen. Now, the fee part is, I think we've had a question about the fee. So this is where you need to find that this is the fee, and we have ample amount of scholarships. So you can get up to 45% of the scholarship in here, and we have the basis. So you can check the basis, explore the basis, and kindly apply. And we have other scholarships as well. See here, we have scholarships if you have been a part of any sports, maybe an R&D or maybe a co-curricular program or a startup or entrepreneur on an innovation project, or if you've been a topper, please, you're more than welcome here. And LPU does provide some of the financial aid. So requesting you to kindly explore, and if you are eligible, apply for the same. Now is the thing as how you can apply. Simply click on apply now option. There are these requirements. You click on bare minimum requirements, you just fill in them and you click on submit, and after that you will be given your dashboard. And from there, you simply just apply for the course or the test. Now, I hope that this brief is, I think, clear to everyone as in what is needed to be done in order to take admission and what you need to know. You can check every detail from this website. But if you have any other query that I could not tell or address in this webinar right now, so what you can do is you simply just schedule a call with us. You either WhatsApp us or have a live video counseling session with us. So you can choose any which way you want, and you can connect to our counselors here, and they will be providing all the remedies, all the resolution of the queries that you have. So I think with this, I would stop sharing my screen, and I would be taking permission from our expert here. That is Tyagarajan sir, professor. Can I wrap this webinar if you don't want to add anything to it?
Okay, ma'am.
Yeah, thank you, sir. Yeah, thank you so much, sir. Thank you so much for coming in, for giving in your time, and for explaining through this great science, like what we can do. And also we have next webinar planned with sir. So I would request everyone to just join us there also. And at last, I would want to thank all the participants also for coming in, for joining in, and for giving your questions, for interacting with us. Thank you so much. So meet you soon in the next webinar. So until then, stay safe and stay happy. And at last, thank you so much for joining in.